Hey there. By now you've watched the anatomy videos that should help you get started on knowing what it is that is inside the ankle and reminding you of the important structures. And then you're going to continue looking through those videos. Before you do, just a couple of pointers to consider. Remember your anatomical terms and remember to pay attention with your assignment that you're using correct language. That is one of the requirements in the assignment. So what I'd like to do is show you first of all some anatomy. Actually, you've seen the anatomy. Let's just talk a little bit about grades of tear. There wasn't any footage on YouTube, so I thought I'd create this little vid for you. A normal ligament, nice and happy, no damage to it. When you start to overstretch, you'll get tiny little areas of damage appearing in a ligament with no actual strain. This is very, very minor. It'll be uncomfortable. It will hurt. You might get a tiny bit of inflammation, but it's not going to be particularly obvious. Grade 2, it begins to tear. Okay, but it hasn't torn all the way through. Grade 3, complete rupture, complete tear. That will require surgery to have these rejoin. They do not magically come back together themselves, so that is a surgical intervention there, something that's definitely out of our scope. A couple of other things just to remind you: positions of the body. Let's have a look here. So, use your terms in terms of medial, like, the medial malleolus. You might refer to lateral down here. Distal is further away. Posterior, the back of the body. Anterior, the front, and so forth. And I just threw these little images in here so you can have a little look over these to assist you. And you've also had that refresher of ankle anatomy from those videos. Now, while you're watching these videos, I'd also like you to pay attention to what is repeated between the different producers of the videos. So you'll find the different people describing elements within their videos of things you should do, tests you should perform, things you should observe. And they don't always address everything. For example, seeking consent and confirming each step with people before you proceed. Not all of them do have that as part of their requirement in their video. However, what you will find is that quite a few of them have similar tests, similar observations, things that you will be looking for. So pay attention to what each individual presenter on these different videos finds important to include that they all agree on. When you hear them repeating those things, they are important, okay? You can use those in your clinic. You may be able to use them in your assignment. However, it's something you should definitely pay attention to. Okay, enjoy the rest of the videos, and you can reference these at any time. These are on YouTube, and you might enjoy some of the other material that these YouTube presenters have created. Some of them have good content.